Lens replacement surgery is carried out in a 10 to 15 minute procedure topically where the patient is awake. There is no pain involved. It's a small incision, a micro incision on the side of your cornea, which allows us access to your lens, your natural lens. The natural lens, as we get older, gets harder, is unable to focus, particularly for near in many cases, and then gets cloudier. And that natural lens, when it's cloudier, we call that a cataract. So lens replacement surgery involves us removing your natural, many times cloudier lens out of the eye through an ultrasound machine that sucks out the cataract or the cloudier lens, and then replacing that within the same anatomical structure, replacing it with an artificial lens implant. That artificial lens implant is injected in through the micro incision and is designed to stay there for the rest of your life and stay nice and clear and give you better vision. Lens replacement surgery is basically the name given to removing your cloudier lens or your harder lens, which is unable to focus for near or even far in many cases, and then replacing that with a new artificial lens. So lens replacement surgery is that. The only difference being within that surgery, you have a choice of which lens you're going to replace your natural lens with. So these artificial lens implants, there are a variety of different ones. Some are, for example, monofocal, giving you really good distance vision, but you'll need glasses for reading. And that's the traditional lens that we've been using for over 40 years. Nowadays, there are better lens implants for distance vision and near vision called the multifocals. And within the multifocals, there are different designs. All of these lenses are trying to make people less dependent on spectacles and therefore, giving you nice clear vision permanently for distance and for reading, and about 90% of people after such procedures never wear spectacles again. Lens replacement surgery is effective in the majority of cases. Like I said, 90% of people or more never wear glasses again after such a procedure where the lens is replaced with a multifocal lens, for example, giving you distance vision and reading vision. You can do your computer, you can drive without needing glasses. And that lens is designed for to stay there for the rest of your life and give you that clear vision. And providing the rest of the eye stays healthy, then you should actually keep that vision because the lens does not rely on the muscles of your eye. It's a stable optic lens that will not degrade and will not require replacement in the majority of cases. Lens replacement surgery is a quick procedure. It takes about 10-15 minutes. It's done whilst you're awake. It's painless. The recovery should be quick in that your vision will be blurry for a day or two. You may notice your eyes a little bit scratchy and watery on the day of the procedure that evening. But the majority of patients, the next morning when they wake up, they don't have any pain, shouldn't have any discomfort really, and you're free to go about your life as normal. You will need to use some eye drops for about a month, and they're important because they help the eye to heal in the right way. And over the first week or so, you should notice your vision clearing and getting better day by day. For example, it may take you in the first day or two when you pick up a book, if you've just had a lens replacement with a multifocal lens, it'll take you a moment to focus. But as the eye heals, as your brain gets used to the new vision, the majority of patients are picking up a book and reading it within the week of surgery and no more glasses. Yes, the side effects from lens replacement surgery are important in that everyone should be informed of exactly the risks and the benefits of the procedure. The risks are very, very small actually with regards to lens replacement. Lens replacement surgery is cataract surgery. It's the fancy name given to cataract surgery when you're having the lens replaced before you develop the cataract, or even if you've got the cataract, you're having the lens replaced with a premium lens implant, a multifocal lens implant. So we know a lot about cataract surgery. We've been doing it for 50 plus years. There's a lot of data, more data on this procedure than any other procedure on the planet. And it is also known to be the safest procedure on the planet because we've got, tremendous success rates of greater than 99% of people noticing their vision's better after this procedure. However, there are always going to be risks involved. The risks with lens replacement surgery are small, but 1 in 1,000 chance of having a serious problem, and that should always be discussed with your surgeon before you decide to have the procedure. With regards to the actual lenses, some of the lenses can give you halos or glare, particularly at night time. So again, the discussion needs to take place with your surgeon with regards to what that will be like and what can be done to avoid that. Now, if you do a lot of nighttime activity, you drive a car at night, you should be aware that halos and glare is a possible side effect from some of these multifocal lenses. And I have to say some of them have a better profile with regards to side effects than others. And that's one of the reasons I will always discuss this with our patients and choose a suitable lens for him or her.